All right, so in this video, we're gonna cover a couple of things. First thing is packing cord, and then how we're gonna make temps, right? So for cord packing, there's gonna be a technique that you wanna make sure you always follow, right? So for premolars and anterior teeth, you want to wrap the cord around your pinky and probably get around that size and cut that much. Okay, so that's for premolars and anteriors. When you're doing a molar, you want to at least get a finger or your thumb. So most of the time we're getting like very small cords, so you want to make sure we get at least that much so we have enough. So once we have the cord, we always pack in a systemized way. So every single time you do it in the same order, so you don't have to kind of guess. The order is the closed part of the cord it goes on the lingual. So the closed part of the cord will always go on the lingual, and then the open end of the cord will go on the buccal. So this way, every time you place it, you're going to end up in the same situation. So in the anterior teeth, your closed part is going to be on the lingual. The back, same thing. So once you place it on the tooth, you just kind of find the spot on the lingual and start packing from there. The way you're going to pack is you're going to push against the tooth and in between the gums and the tooth, but against the tooth, and then you will start walking towards the open part of the cord, which is towards the buccal. And as you're doing that, you want to make sure you don't jump around from one spot to the next in a big step. You always want to walk in like smaller steps like this. As you're doing this, you want to kind of make the cord tight around the tooth. So, and if it's tight, then it's not going to move around on you. Otherwise, if you have a loose piece or like a small piece that is not as tight around here, that will be very hard to pack, especially when it's bleeding. Okay, so you keep going around, and then both the ends will meet in the buccal. If they don't meet and you have an extra piece, take scissors, cut that off slightly close to wherever you need it to be, and then just finish packing, and it should end up end to end. Okay, once that is done, then dry it really well. Make sure nowhere else the cord is sticking out. If it is, then once it's dry, you'll be able to see it, because most of the time the gums are going to be bleeding. You will just kind of lightly push down wherever it is, and you should be able to see the cord slightly sticking out, in terms of like you should be able to see the cord. If it completely sinks in, then it's most likely not retracting the gums. It's going to just go between the gum and the tooth, and then the gums will just kind of fall out. So you want to make sure you don't push it down too much. If the cord is small, then we might have to step it up to cord size 1 if the cord is a problem. Most of the time we're using size 0, but the doctor will always look at it and can tell you, let's go ahead and use size 1 or stick with size 0. Okay, this cord is a little bit different than like your normal paper towel or cloth. On those, you throw it in water and it just gets wet, right? This, if you throw it in Hemodent, it won't get wet right away. So one thing you want to do is put it in Hemodent and just kind of press it down, or press it down with the instrument or your finger, and then you'll notice that then it's kind of picking up a lot more. Okay, so let's get to the main part of the video, which is making the temporary crowns. So let's say in this situation, a patient walks in. Now, this is a prep tooth. So let's just call this like patient that came in and lost the crown that they had, and they didn't bring that with them, right? So now what do? Like if you start with this, you cannot make a tooth that looks like a tooth based off on this kind of like prep tooth. So you have to do one more step before you take the something called the preliminary impression, which is you're going to find the ion crowns. These are called ion crowns. They look like steel, but they're not stainless steel crowns. On the box it says ion crowns molar. You find those. The difference is that this is very soft, so if I push on it, you can see like it's kind of changing shape. Okay, so you'll find the ion crown. You'll kind of like just get a rough size of it, make sure it fits in between the two teeth, and most of the time it's not going to go down, it's going to stick out. That's because this needs to be trimmed. So the way you trim this is you're going to get the interproximal area, which is the mesial and the distal. You kind of curve it up, and then you trim the outside. And then you can try it on. Always try to trim like a little bit at a time. You can always trim more, but once you trim too much, then obviously it might be hard to get a closed margin or closed area. So I'll just trim a little bit more. And what you're checking here is that once you trim it and you're putting it back on the tooth, that it's kind of lining up with the tooth in the mesial and distal and not sticking up too much. So if I push it down right here, I need this to kind of be in line. And if it's not in line, this way, if it's up, then you just trim in the part that's sticking up. So like, let's say on the distal, if it's sticking up, so always remember the gums are gonna go up. So the gums are going this way, and then they go up, right? And then they go down and then up. So your shape of that margin is going to look like that. It's going to go like this, and then it goes up, okay, and then back in. So most of the time we're trimming it like this, which is up in this area, up in this area, okay. Then you try it on. If it's a patient, we'll basically use a piece of wax. So that will help keep the tooth in place, okay? Then you put it on the prep tooth, and then just have the patient bite down, so it kind of like just kind of fits in where it needs to be. And then we'll take something called a preliminary impression. So a preliminary impression is taken with a blue bite, and you're going to find the tray that's most likely, if it's a molar, you can use a short one. If it's a premolar, then you have to use a longer one. This plastic part goes behind the last tooth, and then you ask the patient to bite down.
I was just gonna.
So in this case, this is a lower, so the back part goes like this. So you have to find out first, try it into the patient's mouth, and then once you know where the bottom is or the top part of this goes, then you load that up. So the way it's going to be done is the part that you're working on always is going to have a little bit more, and then the other side will just have one line. That's it. Don't put too much on the other side because it will make it hard. And then you just tell the patient to bite down. That gives you an impression of the tooth. That's going to be enough. You pause it.
Okay.
All right. So the blue mousse or the preliminary is now set. So because this was just on there with the wax, most likely it's going to come off with your temp. Sometimes if the teeth are broken, if they're fractured or are missing a piece, then you're going to end up putting wax on there. And when you put the wax on that broken piece of the tooth, like for example, if this tooth was missing this area, then you will put some of that ortho wax, shape it on the tooth, and then take an impression. The same thing is going to happen. The wax is going to come off with your preliminary. So then you will just make sure you remove that wax from your preliminary. So you have to, if there's going to be a little piece of wax stuck, just take that wax out, because if you make your temp, it's not going to work. So the first step is, now make sure that before you make your temp, try in the preliminary. And that's because you can always mess up where you're placing the preliminary. So if you try to place your preliminary here, it's not going to work. It's not fitting. So always try it in. And the good reference point here is your very front part of the preliminary on where it fits. So if you look at when the patient bites down, can I get some Vaseline? When the patient bites down, you can see that at that premolar is where it ends. And just keep a note of second premolar, for example, here. So when you have your material loaded, you're going to place it back on that same second premolar area like this, because you can only see from outside. So the second premolar is where that preliminary is going to go. If you try to place it right here or here, it's not gonna fit. So because we're dealing with this plastic tooth here, I'm just gonna put some Vaseline here so the temporary doesn't get stuck. Okay, so let's make the temporary. So here's our temp gun. We always bleed a little bit out on your glove so you know that it's set. And then make sure you find the right tooth that you're working on. Load it. Now, one of the main thing here is, like, once you start loading, your tip should not come out of the temporary to avoid any air bubbles. So you're keeping the tip always kind of inside the temporary material and slowly squeezing it out. And start from all the way on the bottom of the preliminary so it's filled up all the way. And then you're going to place it, like we said, in the patient's mouth. You'll find the right spot. The front one was the premolar. Place it on there. Always place the side that you're working on first and then tell the patient to bite down. Don't place on the opposing and tell the patient to bite into the temporary. That's gonna end up messing it up. So always, if I was working on the upper tooth, I would have placed this on the top and then asked the patient to bite into the opposite side. In here, we placed it on the side that we were working on, which is the bottom, and asked the patient to bite down. Okay, now I'm just gonna check here. So you wanna at least wait about 45 seconds or so. So it's not super hard, but it's also not super soft. So I'm checking, you can check from outside, basically from patient's mouth. You can see like some part that came out like this. You can just touch it and see, okay, it's kind of close to where you want it, which is almost 75% like set. You want it like that because you want it to kind of come out easily when you're taking it off to shape it. So you're going to use a spoon and then we'll just kind of tease it out slowly. Okay, and you're going to push it from different spots. If it comes out from here, I'm not gonna push it all the way out like this because it can end up breaking one part. So we'll just kind of go at different spots, push it out, and then it's gonna be like this. So go on the other side and just kind of slowly tease it out and it should come out. Okay, now here the cord came out with it. So sometimes this will happen. The cord will come out with the temporary, or it can just stay inside the mouth. If it stays inside the mouth, you always take it out before you cement this, so the patient doesn't go home with the cord. But if it comes off with the temporary, just take the cord out. Now we're going to start the trimming. So a couple of really important points here is, first thing is you have to be able to visualize the margin. So you have to make sure you understand what the margin is and see where you're going to trim to. So the margin is basically this line on the tooth right here. So you want to trim it up to here, but not too past here. So how do you do that? When you look inside the temporary, you will see the tooth kind of have some extra material past the margin. So you have this margin that is going around kind of like that line, and that line kind of goes around the whole prep. In some areas it doesn't have any extra, some areas it has extra. So if we draw it here, let's say if this is the prep and you made your temporary, you will have that margin right here, right where the arrows are, and you want to make sure you stop at the margin. So when you have extra material past this margin, you don't want to trim it right there, because if you do that, you're going to have a space where this highlighted part is. You want to make sure your margin stops right where this circle is. So if you see over here, it's this line right there. That's the line that we're going to trim up to. Okay, so a couple of things to keep in mind. This area is the contact area, here and here. Whenever you made the temp most likely was touching those two spots. So you want to make sure you don't touch this with the burr. If you do that, then it's going to most likely open up the contact. So there's two little spots basically here and here that you don't want to touch. You can trim everywhere around it because it's kind of rough and it has extra material, right? So most of the time we're going to use these two burrs. Don't use a diamond burr. Always try to use the carbide polishing ones, which is the 7406 or 7901. These two are going to prevent any fractures or cracks on the temporary, so that way it doesn't fracture before the crown is ready. So always trim from this angle and go up to the margin, and not like this. Don't trim like this, because you cannot see. If you're trimming like this, you cannot see where the margin is. So always your handpiece is going to face up. Your temporary is in your hand like this, and you're always trimming from this angle, because here you can see where the margin is. So when you're trimming, you come up very, very close to the margin, and then you stop. Okay, so that's the very first step. So what you do is, we're going to start, and always get a good hand rest, a finger rest. So you want to make sure you use your fingers, rest it on your other fingers, and then hold this in a pen grip. Don't hold it like this. Don't hold it, like this. Always get a good finger rest and good pen grip. So this way you can always go slow or fast like you want. So if you look at my fingers, they're always like resting against each other. That's how I keep it stable. If you try to do this, you're most likely going to sink into the area that's soft, and then cause it to kind of trim more or make like a big gouge it. So just keep trimming. So now I know like the margin line is right here, so my burr stops. The only way I can see that is because if my temporary is facing up. If I was doing it this way, most likely I'm going to keep going. I wouldn't know when to stop. Okay, so most of the time we go pretty fast because we know where the margin is. So the rough trimming, if you see the black line, I'm going up to the black line, but not completely removing the black line. Now there will be all these extra pieces that are going to stick out. So whenever that happens, you want to make sure you just knock it down. Okay. So I'm going around. Most of the time, if everything else is done, this should be no more than 5 minutes from start to finish. A lot of times this interproximal area, this bottom part is going to have extra material that's sticking out. This will prevent your temporary from going in. So when you try to put this in, this bottom part has extra material, it's not going to go inside. So what you do is you basically go right below your contact. Your contact is right here. You're going to go below your contact and angle it this way and trim it. So you see how I'm below the contact. I'm here and here, but I'm never touching that part of the contact, right? So now I know I'm already at the margin because that's how I trimmed it, right? So the margin part is good. My rough areas are gone. I don't have any like sharp or rough areas anywhere. Now the only thing is, if I look at this temporary, there are certain areas that are not shaped smooth. So even though it's not sharp, there's like these kind of ditches like that won't be easy to clean. So normally the shape of the tooth is like this. At the gum level, it's always shaped concave. it's never like convex, right? So sorry, it's not never concave, it's always convex. So if it doesn't go in and out, it always goes like the line, the dashed line is. So what do you do here? So basically, let's say you're already at the margin, you already gotten all the sharp edges off, and you see this, right, which is what we're seeing here. So what you do is you just take flowable, you add that in that little area and make it smooth, make it rounded, and then you just kind of polish it down. Okay, so and so just gonna smooth it down a little bit more. You want to make sure there's not a lot of like holes and like kind of defects. Once that's done, try it on, have the patient bite down, tap, tap, tap. You'll see some blue marks on there. If you see the blue marks, just take it all down. Remember, you're never gonna adjust it inside the patient's mouth, so always take it out. Once you take it out, try to, sometimes you will feel like you're taking off a lot, but that wherever you see that blue mark, you wanna make sure you make a good adjustment. Don't just touch it and put it back in, because it's not gonna most likely remove that blue mark next time. So you wanna make sure you take it down. Now there is a certain thickness to it, to the temporary. So if it's too thin, you'll be able to see through it. So when you hold it up to the light, you'll be able to see where the thin spots are. So in this case, it's pretty good. So I can adjust it wherever I need to for the bite, put it back in the patient's mouth, have them tap, tap, tap. Once those blue marks are kind of light or they're almost gone and the patient says their bite feels okay, then it's ready to cement. So always make sure you know how the temporary is going in. Sometimes there's a little angle that it might go into. And if that's the case, then you need to know how you're going to put it in when you have a temporary temp bond, which is the temporary cement. So then you just load it up with the temp bond. Temp bond does set pretty fast. So you're going to mix it. You do have to keep the prep dry. So you'll put like cotton roll or something in the mouth, have the patient hold the suction, whatever we need to do. Mix the temp bond, give it a quick dry with the air. This one already has temp bond. Put it on. Make sure you push it down all the way and put a cotton roll on it, have the patient bite down, and basically let it set. Don't try to clean the temp bond before it sets, because it will make a big mess, which is harder to clean. So let it set. One thing is make sure all the temp bond is cleaned out. Temp bond is white, so you'll be able to see it very clearly. So you want to make sure you go in and get everything off, and that's it. Patient's good to go.